And finally, to our special segment, Resurgent Africa. Amid the coups and the crises, there are many positive stories from Africa that often get overlooked, but not on this show. Our story today is about a train in South Africa. It isn't just a mode of transportation, it's a lifeline on rails, bringing healthcare to the country's most remote and underserved communities. In 1994, South Africa transformed a passenger train into a mobile healthcare clinic called the Phelophepa. 30 years on, it continues to provide people with eye exams, cancer screenings, dental checkups, and even treatment for chronic conditions. Our last report gets you all the details.
Where there's a will, there's a way. Or in South Africa's case, where there's a need, there's a train track. When faced with limited access to healthcare, they didn't just wait for change, they put it on wheels. And not just any wheels, but railway wheels. In 1994, about 30 years ago, what started as an ordinary passenger train embarked on an extraordinary mission, delivering healthcare to those in the farthest corners of the country. The train was no longer just a mode of transportation. It became a lifeline, an actual clinic on rails. And it didn't start with grand ambitions, just 3 humble carriages with one key mission, providing eye care. Named Phelophepa, a Sesotho word meaning good, clean and health, the train rolled through the countryside, aiming to bridge the gap between remote communities and much-needed healthcare. Back then, people in far-flung areas were lucky to have any access at all to medical treatment, let alone a specialized eye clinic. But as with all things that begin with a spark of purpose, Phelophepa also grew. Over the years, it transformed into something far greater than an eye clinic on wheels. Now the train is equipped with an army of healthcare professionals, doctors, nurses, optometrists and even dentists, making its way to the villages of South Africa year after year. According to officials, nearly 375,000 people rely on this train for care every year. It's no longer just about eye care. The train now screens for cancer, checks for chronic illnesses like diabetes, and even runs a full-fledged dental clinic.
The basket of primary healthcare services that we offer are general health and wellness checkups. We have professional nurses. We offer screening for a range of cancers, chronic conditions such as diabetes. We have a fully fledged dental clinic on board where we offer minor procedures up to restoration as well as extraction.
What started with 3 modest carriages is now a fleet of 2 trains with 16 carriages, each one a moving hospital. But what makes Phelophepa so vital isn't just the services it provides, it's the hope it delivers. For many who visit the train, it's the chance to receive treatment they otherwise couldn't afford.
I came here at Okmo to assist me here to come and check my eyes because I've been suffering a lot from my eyesight. I can't see nothing, so I see blurry. So I heard that there's a train coming here, coming to assist people. So they take like 150 people per day, then come assist them tomorrow. So some of them and some of us, we sleep here because we live far.
With South Africa's unemployment rate sitting at over 32% and with only 16% of the population having health insurance, public healthcare isn't just an option, it's a necessity. Unfortunately, 84% of the population relies on the often overcrowded and underfunded public health system. In that context, a healthcare train rolling into town is a beacon of hope.
I got my eyes checked. I had a pap smear done. They cleaned my teeth. I went for a health check and had a general assessment done. This train is helpful to us. It truly, truly helps. All I ask is that it doesn't end here today. They must come back again and help us even if it's next year. There are so many of us out there who are really sick.
As the wheels of Phelophepa continue to turn, they carry with them not just doctors and medical supplies, but a message. Where there's determination, there is indeed a way. And in this case, that way runs on tracks.